Post-traumatic stress disorder, or PTSD, is a serious mental health condition that can develop after experiencing or witnessing a traumatic event. It affects millions of people worldwide and can have a profound impact on daily life. Recognizing the signs early and seeking professional help can make a significant difference in managing this condition effectively. PTSD is a mental health disorder triggered by exposure to traumatic experiences such as accidents, assaults, natural disasters, or combat situations. Individuals with PTSD may experience intense fear, anxiety, and flashbacks that interfere with their everyday life. PTSD can affect anyone, regardless of age or background. It is more commonly diagnosed in women. Treatment options are available to help manage symptoms effectively. PTSD symptoms can vary from person to person, but they generally fall into four main categories: reliving the trauma, flashbacks, nightmares, and distressing memories; avoidance, avoiding places, people, or activities that trigger memories and emotional numbness; heightened arousal, irritability and anger, difficulty sleeping or concentrating, and feeling constantly on edge; negative changes in thinking and mood; guilt and shame, loss of interest in daily activities, and feelings of hopelessness. PTSD develops due to exposure to life-altering events. Some common triggers include traumatic events, serious accidents, physical or sexual assault, war experiences, or natural disasters. Medical conditions, chronic illness, or severe injury can also contribute. Psychological factors. Individuals with a family history of mental health conditions may have an increased risk. Substance abuse, alcohol, or drug dependency can exacerbate PTSD symptoms. Diagnosis typically involves a comprehensive assessment, including psychological evaluation, an in-depth discussion about symptoms and experiences, physical examination to rule out other health conditions, imaging tests. In some cases, brain scans may be conducted to identify abnormalities. Managing PTSD requires a combination of medical and therapeutic interventions, including psychotherapy, also known as talk therapy. This includes cognitive behavioral therapy, exposure therapy, and eye movement desensitization and reprocessing, or EMDR. Medications can also play a role, such as antidepressants, specifically SSRIs, anti-anxiety medications, and sleep aids to manage insomnia. Lifestyle changes are equally important. Regular exercise, a healthy diet, and practicing mindfulness and relaxation techniques can make a significant difference. Ignoring PTSD symptoms can lead to several complications, such as depression and anxiety disorders, substance abuse, relationship difficulties, and even suicidal tendencies. While it's not always possible to prevent PTSD, taking proactive steps can help minimize its impact. Talk openly about traumatic experiences with loved ones. Engage in regular physical activity and stress management techniques. Seek professional support early if symptoms arise, and avoid unhealthy coping mechanisms like substance abuse. 1. Can PTSD go away on its own? PTSD symptoms may lessen over time, but professional intervention is usually required for full recovery. 2. How long does it take to recover from PTSD? Recovery varies for each individual, ranging from months to years depending on treatment effectiveness and personal resilience. 3. Can children develop PTSD? Yes, children can experience PTSD after traumatic events, showing symptoms like delayed development in speech and motor skills. 4. Is PTSD treatable without medication? Yes, psychotherapy and lifestyle changes can effectively manage PTSD symptoms in some cases without medication. 5. How can I support a loved one with PTSD? Providing emotional support, encouraging professional help, and educating yourself about the condition can help.